So afatinib has garnered FDA approval for EGFR mutations, regardless of the nature of mutations, as long as they're actionable. So either exon 19 or exon 21 are clearly actionable. In the two critical phase 3 trials that prospectively assessed afatinib in this setting, it demonstrated a statistically significant and clinically meaningful improvement in both response rate and progression-free survival versus standard chemotherapy, pemetrexed and platinum in the case of Lux-Lung-3 and gemcitabine and platinum in the case of Lux-Lung-6. And in fact, those two trials were the largest prospective phase 3 trials ever conducted in individuals with EGFR mutations. So afatinib's role is clearly established. It's on par, at least, with erlotinib and now gefitinib, which was recently reapproved specifically in this setting. Unlike exon 19, however, afatinib has not demonstrated an actual survival benefit versus chemotherapy in this setting. So at least in terms of efficacy, we can't necessarily point to afatinib as necessarily superior to erlotinib or gefitinib or infer that it might be superior, but again, it's at least on par. With respect to toxicity, it can be a challenge. It sounds as if this individual, Sarah from Brooklyn, who has a very busy life, she's a physical therapist and active in community theater. Certainly cancer was not on her agenda, it never is, but she wants to maximize both her benefit and also maximize her quality of life and minimize toxicity. So in an individual of this sort, it is absolutely crucial that prophylactic measures be instituted to help prevent or mitigate the toxicity. In this case, diarrhea was clearly more bothersome than her skin rash. So instituting diet modification and loperamide reactively is really not the optimal move. It is better to institute those measures proactively. As for concomitant medication, she is on a proton pump inhibitor. Proton pump inhibitors can decrease acid in the stomach, which may in turn reduce uptake or absorption of agents such as erlotinib or afatinib. We don't really know the full pharmacokinetics, but regardless, it would be important, if possible, to stagger the dosing. These agents should generally be taken on an empty stomach. I'll often recommend taking them at nighttime. Because toward the end of the day, I find that they're better tolerated, that some of the GI side effects aren't quite as severe. If this proton pump inhibitor is taken at nighttime, then it may be more important to take it in the morning. But generally, most standard medications that individuals take are usually in the morning, either with breakfast or before breakfast. So nighttime dosing may prevent any issues with regard to drug-drug interactions.